Hey, what's up, everyone? It's Dr. Glenvo. I am super excited to bring an old friend back. We've done some videos in the past. Now she is back. It's Dana with Prospa Billing. Dana, what's up?
Hi, Dr. Vo. Not much. How are you been? Yeah.
Well, I'm so excited that you're here because, again, all the time in our groups, in our communities, and whenever I run into dentists, they're always talking about, man, I'm trying to hire someone new, or someone just left my practice, and it's so hard to find the right team members and whatnot. And look, I tell other doctors, I say, look, I mean, you can't outsource yourself if you're a dentist. I mean, you can hire an associate, but if you're the practice owner, you can't outsource yourself. You got to be there. But there's a lot of things that you can outsource, not only to make up the missing team members you have, but what I like to say is really help your existing team members. Like, they probably have so many things on their plate. But before we get into what Prospa Billing can do and how that can be kind of like the missing link in your practice, Dana, you are just like a wealth of information and such a great resource for those who are maybe don't know who you are, or maybe they met you before, or they've seen you before, but they're not sure like exactly what your background is. Can you just share your background when it comes to dentistry? Like, again, you're not just someone here just maybe just hire you just they need someone with a nice smile and say hello to people, right? Like, you really
Right.
have some great experience. So just share with us like your background when it comes to dentistry.
Yeah, I've been very fortunate just be exposed, getting exposure to all aspects of dentistry. I started out as a typical RDA in California, worked in many practices, and then like most dental front staff, they were probably thrown into a position that they didn't really want, but had to learn it, and that was me. So I was doing both front and back, and I just really started to love collecting the money for my dentist, and I didn't know how to do it, and so I really just self-taught myself. Most of my mentors were from the insurance carriers, the reviewers, representatives. So I was really just engulfed myself into that knowledge, and did that for a good 10 to 12 years, and then relocated during the market crash in 2009, and then I went to Arizona, and like most of us Californians, we got the heck out of Dodge, and in Arizona, it was mind-boggling. These poor dentists they were going bankrupt, losing their practices.
Oh my gosh.
But yeah, in the culture in the industry, the dental industry is quite different in California than most states, like you have in New York and California. Very competitive. You had to really know your stuff. So I was able to take that experience and really apply it to Arizona, and help multiple doctors save their practices. And it was just as simple as teaching the staff. They really didn't have the knowledgeable staff, so I was actually going in there and just consulting with them, and putting the right team members and workflows in place. And that just kind of bloomed. And then I relocated to the East Coast and became a consultant for remote dental billing companies, and I really enjoyed that. But something about Prospa really intrigued me. We had the same philosophy. It was dental. The owner his brother's a dentist, and we just really communicated on a level of philosophy, and we knew what dentists really needed, and where the breakdown was coming from, and it was staff retention, knowledge, and we were able to just really collaborate and create something really great here. And it's been tried and true. We grow organically. We would love to be bigger, and we can scale that, but we love the personal one-on-one partnerships that we have with our clients. So it's been great. It's been a great ride. I love what I do, and I'm like a unicorn, I guess. I just do everything.
Well, I'm glad that you were really thorough about your background, because again, what is really unique about you, Dana, is that you actually have been in the trenches, right?
Yeah.
So again,
Oh
so
yeah.
many times as dental professionals, if we're working with someone who's like from a revenue cycle management company, and we're always wondering who we're talking to. Like, do you understand what I'm going through? Like, do
And
you
what I
understand
need.
that? Yeah, do
Yeah.
you understand? Like, I'm a dentist and I'm working here, and then I'm trying to deal with my staff and I'm trying to deal with my patients. And I love the fact that, look, you started as an assistant, and
Mm-hmm.
and what you were saying about getting thrown in. Look, a lot of times our team members were like, "Hey, we're missing someone here. Hey, would you like to learn how to be in the front?" Well, like, hello,
Right.
or sometimes our teams are thinking like, "Wait, what did I sign up for?" But I love the
Right.
fact
Yeah.
that you've been through all this, because let me ask you this: has this been able to help you as far as like the communication and relationships with these offices, and talking to some team members who, let's be honest, sometimes they're probably overwhelmed, right?
Yeah.
Like, has that
Yeah.
helped you just kind of connect them with them on like a personal level?
Yeah, yeah, relatability. They can relate to me instantly. Just like you said, Dr. Vo, when you're calling a billing company, you want to know that you're relating to them. So that's really why I do most of the discovery calls. I want to relate and let them know we know your pains, your aches and pains. We're going to help you. It's going to be easier than you thought. We're experts. We can jump right in, hit the ground running. All your problems are going to be mostly solved on the RCM side. And then your great gals can focus on being gregarious and
Yeah.
handling the day-to-day stuff they signed up for.
So you're telling me that when a front office says, "Dana, you don't know how it feels to run the front and have to go back there and take x-rays." Like, when they say that to you, you literally can say, "I actually do know how
Oh
it feels."
yeah, girl. I remember Fridays. No one could interrupt me. And they're like, yeah, yeah. No one could interrupt me. I had to get all these checks posted and try to work in as much AR as I could. Fridays was the day. Everything else took the back burner. And then during the week, AR took the back burner because I had to juggle. So they really appreciate that, when I relate to them. And I do. And the doctors. They're struggling with, I have this great gal or great staff member, but it's lacking right here, and it's
Yeah.
really not their fault. They don't know what they don't know. It's almost getting to the point where you have to be a CPA to do insurance, and or have some kind of accounting abilities, and that be your main focus. It's hard to do both, and I can relate because I had to do both. So yes, when I talk to the office gals, once I get through the discovery, they're just like, "Where has this been all my life?
Yeah.
I can't wait for you guys to get started." And we're very transparent. We want to make sure we're a good fit. And so we walk them through exactly what we do, how we operate. It is different than an in-office person, obviously, but it doesn't derail them from their
Yeah.
regular task, or it won't affect them. And it just makes everybody much less, stressed out
I
about the
think I
whole
think this
RCM.
is I think this is a perfect segue into my next question here, and that is, you know, outsourcing dental insurance verification, the dental billing, some front office duties. I mean, that's something that's been talked about. There's been companies that do it, right?
Yeah.
And I've talked to other doctors where there's like, well, I'm not sure if I'm ready to do that, and maybe my team is not ready for that. But Dana, you've been in this industry long enough to see all the changes, right? You
Yep.
see a lot of changes, but you also see a lot of things that still to this day is lacking in dental practices, right?
Mm-hmm.
Like, I mean,
Mm-hmm.
it's like the same problem that exists today existed like 10 years ago.
Yeah.
But
Yeah.
why is now the time to consider, for the people who are watching right now, people who are listening, why is now the time to consider getting some help when it comes to outsourcing some of these tasks from your front office? Why is now
It's
the time?
yeah, it's a great question. Because we're looking at how
Yeah.
inflation is a big issue right now.
Oh,
We're
yeah.
seeing it everywhere. It all started with COVID, obviously, and now more and more staff members, they're starting to think about different career choices. A lot more companies are starting to outsource remote positions, hybrid positions, and it's really hard for dentists to retain staff, and that's
Yeah.
really been the biggest problem. And then the staff that they can retain, they're overwhelmed. So it's really just putting your revenue in the hands of someone that maybe can't handle that capacity. So now's the time. It was the time 3 years ago, but now we're really getting to that point because A lot of staff members are asking, for double the amount that they used to 2-3 years ago. And dentists are paying a lot more to have an in-house staff member, whereas the service, is a lot more economical. The ROI, it comes back in the first month, and you don't have to worry about turnover. You don't have to worry about, hey, Prospa wants an increase in their pay. Prospa wants PTO, and you don't have to worry about that. So if you're trying
and then training somebody, I mean, you can't just hire somebody off the street and expect them to understand how to do billing and whatnot. And again, it's just, when you work with someone like a Prospa, it's like you almost don't skip a beat, because this is what you guys do all day long, all week long, all year long.
I always compare it to the analogy of a hygienist. She cleans teeth better than a dentist, because what is she doing? She's doing that all day long, all the time, right? And in vice versa, she doesn't know how to do fillings. You do. You're doing that. So it's 10,000 hours makes you an expert. Well, we have multiple decades of experience on staff that have been doing this for 25 to 30 years. And it's not just in one practice. It's multiple practices dealing with multiple products and plans. So the knowledge is vast. You'll probably never be able to hire someone to come into your office with that type of knowledge, just because of the collaboration of knowledge we have and the exposure we've had.
And if you do, you're actually paying a lot for that.
Yeah, you're going to pay a lot more, and they're going to want probably a partnership in your practice.
Yeah.
Or a percentage, maybe. I've heard of that as well. It's getting bonkers out there. So yeah, I think the easy solution is hire a billing company that has these experts that know their stuff, that it was founded on, a dental professional in the industry, and that knowledge. I think when you're looking for a remote billing company, you really do want to investigate or research, do your due diligence when it comes to that.
So, I'm actually on the site right now. We want to talk about, a lot of things that Prospa has when it comes to offering services to dental practices and what they can outsource. And guys, we'll have the links to the site in the show notes and also in the comments section. Definitely look through it. But again, we talked about why is now the time to do that. Well, you might not have enough team members. Most people are short a team member. Maybe you are short a team member and you have a bunch of rock stars in your practice, but they're also doing like triple the amount of work. What better way to take care of your team and actually increase retention? And Dana, you were talking about that. Look, I mean, pay is one thing, but the work environment is another, right? So if you're working your butt off and like literally the work environment's not good, I don't care how much you're paying somebody, they're going to be gone, right? And so again, having someone like Prospa, someone who's helping out like a partner in this, is huge. So you're on the site, you can see all these different things, but I want to go over a couple of things that are listed here, because people are probably thinking like, what all is involved when what can I outsource to Prospa? And I'm looking here, we got dental insurance billing and claim submission. Talk about these two things and we'll just go down the list here.
Yeah.
So dental insurance billing and claim submission, again, is that something that Dana, let's be honest here, is that someone like who's just worked in, maybe you hire someone from retail or from the restaurant industry and you say, hey, do this? I mean, let's be honest here. How long, if you had to train somebody who had no experience, I mean, how long would it take for you to train someone fresh? These two things, dental insurance billing and claim submission.
A good 6 months, probably. I mean, if they're coming to work for us, they're trained. We have retired dentists that are on staff as billers. We have certified dental billers and billing specialists that are on. So there is no downtime for training, and they are trained in the knowledge base of how is the insurance going to process this claim, not going through a checklist. I have to add my chart.
They're not just mindlessly just doing it and getting things denied.
Click, and just copying and pasting doctor's notes. We're actually if we're looking at Cigna, we're putting in our narrative in the attachment software, not in the remarks section of box 35 inside of EagleSoft Dentrix Open Dental, because Cigna will never see that. These are the nuances that we know about, and this is what's going to prevent your claims from getting denied, or that those agonizing letters that they are requesting additional information. And you're going, I've sent this 5 times. Why aren't you getting it? It's really through that EDI transmission when the EDI file is converted over to the insurance company. You really do have to know what you're submitting. And that's what our experts know. So they hit the ground running. They get right into your PMS, your practice management system. They audit the claim, they scrub it, they make sure whatever carrier it's going to, that it's meeting their criteria, and all those little nuances, like I just spoke about with Cigna, that they're being tackled. And it's really designed to, because we want to get paid like you do, and we don't get paid until you do it. So we want it going out the first time, so we're getting paid within 30 days, not for it to go over the 30.
I mean, you guys have a vested interest, and again, I'm not bad mouthing anyone's team members. Everyone's got great team members. Okay,
it's a different perspective. That's all it is. Man.
But the thing is this: like if you're a dentist like me and you're actually seeing patients and you don't have time to be looking over someone's shoulder, what happens is you get a nice surprise like a month or two later, and like, what, things got denied, and I'm missing all these things, right? And then you're just chasing money down. But you guys, Prospa, as a partner for you guys, for those who are listening, they have a vested interest.
That's right.
Getting this done efficiently and quickly, because we all win together, we all work together. And I'll say something like, again, dental insurance verification, patient billing statements, all these things that add to that bottom line, right? So again, from the beginning, if you don't have your insurance verification done right, Dana, what happens if you screw that up in the beginning?
Well, it doesn't, your claim can still go out, but you're going to probably have an angry patient. So if you're not, if you're not verifying, you're giving the wrong treatment plan, plain and simple. And if those aren't, done correctly, we're sending out the claim correctly, we're scrubbing it, but it's coming back denied because the patient wasn't eligible or waiting period. So it really does start, it's a domino effect after that. Yeah. We'll get your money, but you're not going to look like an efficient office that doesn't, basically has their act together. So patients want to be told correctly the first time. Now, there's always a leadway. It's always an estimate until insurance pays, but you want to at least show that you did your best to treatment plan that.
Or like at least in the ballpark.
Exactly. Yes, exactly. Not that I didn't have the coverage at all, and that really seems to be bogging down the offices. So when we take over in the RCM side, most offices they try to figure out what to do with our staff members. It's a real question for dentists to wonder, what do I do with my staff now? That was their job. Well, you can restructure their role to do more important things, like try to get on scheduled treatment, scheduled. Now you have more time. Go ahead and verify those insurances. You have time now. So there's still a lot to do, because remember, their plates were very full when they had to handle the insurance side.
Filling the schedule. Again,
filling the schedule,
which is guys, what I would say, like the two most important things that someone in the front office could do for you is fill your schedule and fill it with people who have treatment that needs to be done.
That's right.
Like, don't have them do all this other stuff that honestly the folks at
Prospa can do.
Yeah, honestly, the folks at Prospa, let's just be honest here, they're probably better at it. Again, there's no knock against your team.
No,
they're probably better at it because this is what they do.
That's right.
They're not greeting patients at the door. Okay.
Yeah, they're doing that a lot better than we are. And exactly, we're just exposed, and your staff is only being exposed to your office for how long they're there. We're getting exposed to multiple offices across the nation, learning about all kinds of nuances and issues that are changing beforehand. For instance, I just spoke to an office, and she wanted us to do a peer-to-peer review after three appeals, and we had to explain to her, well, something new has come up where you must request the peer-to-peer before you do one appeal, and she did not know that. So unless you're involved in this, you're getting this information because you're working on certain states and claims, you're not going to know that. And that's where we can come in and really expedite denials and delays for doctors. So that's why now is the time. You need to get paid for the work you're doing, and we need to collect it for you, right away. If you're on EFT, you're getting paid in 72 hours. That's another thing. You have to enroll in EFT. Most offices don't want to do it because the office managers, again, they don't have the time to go through all these portals and manage that. But we actually have a team member that's dedicated to your office, that will go on every single portal every week and document when the payment was ready, when it was pulled, and when it was posted. It is a great monitoring system for any doctor that wants to know what's going on, what's in my bank account. Is it getting
Well, you get your money faster too. I mean, that's always
get your money faster. It prevents embezzlement. It prevents all kinds of issues, and it just helps you be more efficient. And when you're working with a remote billing company, it's almost a must. And then what we do, we are offering, that's one of our perks that we're offering, complimentary EFT enrollment.
nice.
Because some of our competitors charge for that. That's fine. We feel it's a necessity to be efficient, so we include it. It just helps us be a better partner to you. And all this is monitored on our custom dashboard that we provide you. So doctors, you're going to get to see what the health is of your AR, once and for all. You'll be able to look at this tool and look at every single claim, last time it was worked, your collection ratio. You're going to be able to unpack your AR buckets. We give every claim a status and an action. So if you see 30,000 sitting in 60 to 90, you're going to be able to hover over that and see that 2,000 is the EFTs previously paid, never posted. 5,000 of those could be additional information requests. So you're going to actually get a breakdown and have peace of mind. I know what's going on. It's being managed, monitored. It really will give you that peace of mind, and the staff too. If that's been a monkey on their back, they know they have to get to it and they just can't. That's really where they embrace us and feel they can breathe now and just do the day to day and not worry about, because we're on it, and we have a really nice monitoring system that helps you stay. It's transparency, accountability. We have 2 layers of audits. We give you your billing team, and then they have an auditor, and then that auditor has an auditor. We want to make sure things are, we have really great quality control. And that's something that not one office can do. Like you said earlier, doctors don't have time to monitor. Yeah. Office managers don't have time to monitor. They rely on reporting. Then it's too late, like you said. So there's a lot of benefits that we offer with our tools, our experience, and our workflows.
We'll talk about more of the benefits. Again, that's like just enrolling in that program. That's part of the program. That's huge too. There is like a nifty deal, guys. We'll talk about that. But I do want to point out something, because many of you guys are probably wondering, well, my office is different, right? Like maybe you're a GP out there. It's like, okay, this is work with general practices. Maybe maybe you're an endodontist. Maybe you're an oral surgeon. Maybe you're a pediatric dentist. I mean, so we're on this particular part of the page specifically because you see all this. I mean, Dana, it seems like you guys work with almost every specialty out there. Let's start with this. Is there anyone in dentistry you guys don't work with?
No, we don't.
They work with everyone. They work with anyone. So whether it's whether you're an oral surgeon, whether you're a pediatric dentist, all these things. And of course, let's be honest, guys. I mean, every office is going to be different, right? Yeah. There's going to be more codes used and whatnot. Let's say, if you're a perio office and you're a pediatric dentist, right? There's going to be things. But Dana, whether you're a perio office, whether you're a pediatric dentist, have you guys worked with and can you work with these practices?
Yes, we can. And we've been very successful at it. Oral surgery, we do hospital billing, trauma billing. We have medical cross-coders on staff. They know how to bill Medicare. They know how to bill Medicaid. We do have.
It's a lot of money left on the table if you don't do that, right?
That's right. Oh, right. Yeah, especially in specialty. There's a lot of medical necessity out there, even in GP. So if your patient has medical insurance, you absolutely want to try and bill for that.
So I just I'm on the About Us page, and of course, we see Dana right here. Awesome picture here of Dana here, and of course we have Manny. And a lot of times you guys might be talking to him, right? So again, Manny has just a wealth of information. And I'll say this, for someone with the experience that Dana has, and for her to be with a company like Prospa, that has something to say. That should say something right there with Manny here. But again, just to highlight on how, you're proud of working with Prospa. But what would you say makes Prospa different than the other companies out there? Because I'm sure you have a lot of people that come over and they They're like, hey, we came from so and so place, and we're coming to. What is like one of the biggest reasons? One of them, we don't look. We're not in the business of calling out people, okay? So we're not going to
No.
call out anybody. But what is one of the common things that you get when people come over and they are talking to you, Dana, and they want to come over? They ultimately become clients of Prospa. What is like one of the biggest things that they're missing over there that they're getting at Prospa?
Organization.
Yeah.
I get asked this question every single time, and we do get people that are coming over from other companies, and we're listening to their experience. And listen, we all know what to do. All the remote billing companies out there, we all do the same thing. We remote in and we send your claims. It really boils down to communication, organization structure, workflow, and processes. And I think that's what sets us apart. And we have our communication tool. No one's doing what we're doing with that tool. We have the tech. You have to combine it, and I think we've figured it out. We've cracked the nut on that, and we're not trying to be too fancy. It's basic stuff. It's just tools to help our team be efficient. When we hire in dental industry candidates, they come with a plethora of experience. However, we want them to follow our process because it's tried and true. And I think that's the difference. That's the main difference. Because I have worked for some of my competitors and they're great. But I think our structure outweighs any competitors out there because, again, I've brought my industry knowledge and helped my CEO understand what dentists need, what they're lacking, what they need to see. And he's been able to work with me or I've been able to work with him and collaborate and get that structure in place, and it's working. So really, I think that's the big difference, Dr. Vo, is just the structure and organization. Doctors love it. They just want to know what's going on. Are things being managed and taken care of?
So Dana, for those who are watching right now, they're like, okay, I'm ready. I'm ready to make the jump and help my team focus on what really matters in the practice, right? Front facing duties and whatnot. I'm really get started. Or maybe there's someone who's listening right now and they're like, well, I'm with so and so company and I don't feel like I'm getting the service I want, or the communication is not right there. I'm thinking to move. Or what are the first steps? What would you tell someone who's interested and who wants to get on a discovery call with you? What's the first steps?
Just go onto our website and click schedule a call. Then they'll
Simple as
that. They'll get a 30-minute discovery call with a 30,000-foot view, and we're basically going to walk through our workflow, how we can customize our service to help your practice and what you need. You might not need posting, you might not need billing, you might just need AR cleanup. We can customize it. You might need all three services. You might need only two. So we like. But
you guys don't force down like a kind of like a cookie cutter plan. Like this is
right.
This is like plan A. You gotta do this.
Just because your offices aren't cookie cutter, so absolutely not. Yeah, we will customize. As long as it doesn't affect our workload, that can affect our success for you, then no problem. That's where that discovery call comes in, right? We have to make sure we're both a good fit, and we haven't had one say, no, you're not a good fit. Everyone likes the model. I think our pricing is comparable. I think you can't afford to not do something right now, whether it's with us or another billing company. I hope we get your business, but you really do need dentists. It's going the route that all medical doctors are practicing, outsourcing their billing. It's a must. You'll never find medical billing inside the practice anymore. And that's how dentistry is going. I know it was taboo to ever outsource your billing, but it's just not like that. Insurance is convoluted. It's you have staff retention issues or staff knowledge issues. And their plates are full, and like my rockstar office managers, I feel for you, and we're here to help. It's a simple solution, and once you try the service, you're going to think, why didn't I do this sooner? Like my life has been so much easier. So yeah, we want to meet you. We want to talk with you, how we can help you. Nothing has scared us away yet. It's okay if you have 2 million in AR. I hope you don't, but it's okay if you have 15,000 in AR. We can handle it. And I think that's another thing that will set us apart is our scalability. A lot of our competitors pile multiple offices on one gal. Well, that's the problem you're having in the first place. One gal cannot handle it. So we have a team for you. We have a scalable team. Yeah.
I think that's so huge. So first of all, Dana, thank you so much. It's so good to see you again. I'm so happy that Prospa's got like the super nifty deal. We're gonna have that in the comments there. But look, I mean, if you are considering this, or if you're not happy and you're listening to what Dana and her team does on the Prospa side, and you're listening to it and you're like, why am I not getting that? Yeah, ask yourself that. Why aren't you getting that, right? And really go to the website. We're gonna have the link there. Click schedule a call. There's a good chance that the person on the other side is going to be Dana, but if it's not Dana, it's going to be someone just as amazing, but hopefully it's Dana. But take that first step there. All you got to do is, if you guys are ready to rock and roll, to ask for the nifty deal. But Dana, thank you so much for jumping on.
Thank you, Dr. Vo. We're so happy to work with you and your members, and we're excited.
Yes, I'm excited too. And guys, I mean, Dana's very efficient with her time, so chances are, like, she'll go through a lot of these. So blow up her inbox, please. Yeah. Fill up her schedule.
I'm waiting.
Fill up her schedule there. But Dana, thank you so much for jumping on.
You're welcome. My pleasure. Good to see you again.
Guys, thank you for tuning in, and make sure you reach out to Prospa. At the very least, find out what you're missing in your practice, but also what they can do for you as well. Thank you. We'll see you guys next time.
Bye-bye.